Correcting metabolic acidosis, also known as acidemia, is critical in turning dehydrated scouring calves around. And the goal of our research was to find out which blood buffer is most effective at performing this task. I think a good place to start with what are the symptoms of a dehydration that are associated with diarrhea. And this study does a great job of examining this. This was work done in Germany in a university vet hospital where 1,400 critically ill neonatal calves with diarrhea were presented to the clinic, and clinicians came out and physically evaluated and drew blood from these calves with the goal of finding out what are the clinical signs and lab findings that best correlate with 48-hour mortality from scours after being admitted to the hospital. And they found the clinical signs were a lack of suckling reflex, depression, recumbency, eyeball recession, suffering from sepsis, and hypothermia. But hands down, the leading laboratory finding that predicted mortality was profound acidemia. Their take-home message was, if you prevent acidemia when calf scours, you're going to save a lot more scours, or save a lot more calves. Three of the more interesting historical studies conducted on electrolytes were, the first one is here to the left, a study done in Canada where they compared an electrolyte that had no blood buffer, just dextrose and electrolytes, to one that contained sodium bicarbonate at 80 milliosmoles per liter, to another that contained sodium acetate, also at 80 milliosmoles per liter. These calves were inoculated with a field strain of rotocoronavirus. They experienced profound diarrhea, and you can see a dramatic improvement in recovery rate if a blood buffer was included, and both bicarb and acetate seemed to work. A more recent study done by Dr. Jeff Smith and his group at NC State compared a sodium acetate containing electrolyte to the use of lactated ringers, either administered IV or sub-Q. I find in the field that ringers are commonly viewed as one of the best recovery tools for correcting dehydration in calves, and they are a useful tool. But Smith actually found in his study that blood pH was corrected more quickly at 8 hours with the acetate containing electrolyte, and blood glucose improved within 2 hours. Two very important criteria as shown in the German study to save calves. And they were done it more effectively with the acetate containing electrolyte as opposed to either application of ringers. Another important consideration with electrolytes is the effect of sodium bicarbonate on the gastric bactericidal barrier, in other words, the pH of the abomasum. We know that E. coli and salmonella proliferate when exposed to a pH greater than 5 or 5.5 respectively. And what Smith did here was he tracked the pH of the abomasum over a 24-hour period, and when sodium bicarbonate electrolytes were administered, found that between 35 and 44% of a 24-hour period had a pH greater than 5.5. In other words, we're in danger zones for E. coli or salmonella to proliferate. Whereas if an acetate containing electrolyte was used, it was less than 10% of the same 24-hour period. In the US and in Canada, we find a wide array of different kinds of electrolytes. At Animix, we make many of these on a private label custom mix basis for customers. By far, the ones we make the most of are just simple dextrose salt, sodium bicarbonate containing electrolytes. Commonly, they contain sweeteners and flavors, so they're more readily consumed than water alone, and they're commonly presented as a midday bottle of electrolyte containing water in hot climates during scour periods, upon arrival at a calf ranch or in the bowls of in a veal farm, in a veal barn. But when calves start going off feed or becoming more moderately dehydrated, that's when we need to introduce sodium bicarbonate or sodium acetate, some of these blood buffers that get converted to bicarbonate in the liver of the calf. They're maybe more effective in correcting acidemia. And the goal here is to head calves off at the pass before they're severely dehydrated, where you need to rely on IV fluids, which are difficult to administer and expensive. So we know metabolic acidosis occurs with much fluid and electrolyte loss that's associated with diarrhea. So our goal was to find out which blood buffer is more effective at preventing or correcting acidemia in calves. Is it sodium bicarbonate, a basic bicarb electrolyte, as the sole blood buffer administered at around 50 milliosmoles per liter? Or is it one of mixed blood buffers, including a base load of bicarb, but then introducing sodium acetate which has some product handling problems in that it reacts with dextrose and glycine and moisture to create lumps and sometimes almost bricks out of the powder. So we found at Animix we can put in, that's the maximum amount, 6.3 milliosmoles per liter, and we introduced sodium citrate, which has a limited amount of calf research but is widely used as a blood buffer in human nutrition, or in some potassium citrate, again at around 50 milliosmoles per liter, or where we administer the sodium acetate as 100% of the blood buffer, again at 50 milliosmoles, but administer it via liquid, taking the concern of caking or lumping off the table. Our hypothesis was that a multi-source blood buffers would hydrate better than sodium bicarbonate alone, and correct the acidemia, and hopefully would be on par with sodium acetate as the sole blood buffer. We conducted this research at Mapleview Agri, a milk replacer manufacturer in Ontario, who has been doing very good on-farm controlled research on various attributes, various compounds of milk replacers and supplements. Whole blood was drawn on these calves to measure serum total protein. A milk replacer containing skim milk was fed, so we could also consider the effect of bicarb on that. Calves were enrolled within the first 3 weeks upon arrival in the facility, and a vet tech came out midday. They were blinded from what was being administered to the calves, but they were there to measure clinical signs of hydration. Calves were enrolled after being identified with 2 consecutive days with a fecal score of 2, which is runny, spreads easily, or a single day with a fecal score of 3. When enrolled, the calves were randomly assigned to one of the 3 electrolyte treatments. All 3 contained 50 milliosmoles of buffers per liter, fed at 1.9 liters, administered twice daily via an esophageal tube feeder. And that was continued until the scours were resolved, which is a fecal score of 0 or 1. This shows the chemical nature of the 3 electrolytes in brown in the middle. You can see all 3 contained around 50 milliosmoles per liter. Again, the basic bicarbonate one, 100% from sodium bicarb. The multi-source one from a combination of bicarb, acetate, and citrate with a bit of potassium citrate. And the liquid one, 100% from sodium acetate and liquid at 50 milliosmoles per liter. I included the typical commercial low-cost electrolyte to show you the strong ion difference in most electrolytes that are out there. With salt, the chloride levels makes this SID poor. Our nutritionist, Renelle Bloom, standardized these as best she could to be the same on SID that we studied. And also you can stop this at some time and compare how we looked at these electrolytes compared to Smith at NC State or Penn State, and you'll see that we used recognized parameters. The experimental protocol was that the calves were fecal scored for at least 14 days after being enrolled, and they were scaled on a digital scale day 1, 2, 7, 14, and 28 after enrollment. A handheld iStat analyzer was used to measure blood gases at 1, 8, and 24 hours post-enrollment. And the microbial treatments were monitored. You can see the regimens they were used to treat scours. The clinician came midday to do hydration scores based on attitude, eyeball recession, and skin tinting. Calves with respiratory disease were diagnosed and treated using a scoring system. Fecal samples were drawn, 4 calves from each group, and tested for rotavirus, coronavirus, crypto, E. coli, and salmonella. You can see the statistical analysis that was conducted. Around 15 calves in each treatment group were assigned. They came from dairies, auction barns, and an order buyer. Serum total protein averaged 5.8 grams per deciliter. 13% of the room was experiencing FPT. And by chance, the basic bicarb group had higher incidence with roughly a third. Days to reach the barn enrollment varied, but around 7 days. And fecal samples showed high prevalence of crypto, rotavirus, coronavirus, but no E. coli and no salmonella detected. The duration of the scours took an average of around 4 days. A little over half the calves were treated with the first regimen to treat diarrhea, 11% with the second regimen, and almost 2/3 of the calf were treated for respiratory disease. Only in the case of bicarbonate powder did we note with the physical indicators of dehydration more severe eye recession as compared to the mixed buffer powder, and there was no IV fluids, no mortality, and only nominal incidence of milk replacer refusals, indicative of moderate dehydration, not severe. Although these average data gain numbers looked interesting on the mixed buffer powder and high acetate liquid the first couple of days, I think this is a great example to show that there's so much variation in average daily gain when calves are scouring. There was no difference between the groups. The total carbon dioxide is a measure of blood bicarbonate, and it was noted that the mixed buffer powder and the high acetate liquid were noted higher total carbon dioxide levels. As far as sodium, and sodium is important. Some of the earliest electrolyte research showed that daily stools from a healthy calf contain 3 to 4 milliosmoles of sodium, while stools from a scouring calf have nearly 100. And sodium repairs extracellular fluid volumes. And the German study found that dehydrated calves had a lower 48-hour mortality and they survived more if they had increased sodium levels. And you can see that all 3 treatments increased sodium levels, but the mixed buffer one increased them at a higher rate. Now, in all the all-important blood gas measures for acid base, you can see that actual blood bicarb levels were higher in the mixed buffer and the high acetate liquid as composed to the basic bicarb. Base excess, which measures the amount of excess bicarb available. You can see with the basic bicarb group, they were getting at a deficit level at 24 hours. And the anion gap was higher, again, an indicator of acidemia, and the basic bicarb group had higher levels. Now where the rubber hits the road, normal blood pH range. You can see that there was, even though there's no significant difference, we did reach a P less than 0.06 higher level at 8 hours and 24 hours with the mixed buffer and the higher acetate liquid as opposed to the basic bicarbonate powder. So now, in summary, which blood buffer is better, bicarb, sodium acetate, or mixed buffer? In our study, we found that mixed buffers in at least moderately dehydrated calves showed improved blood gas acid base as compared to bicarb alone, and mixed buffers performed comparably to high rates of sodium acetate. Thank you.